Poor financial and people management have been identified as the reason for the Northwest Province's Health Department to have been put under administration by national government. The department addressed stakeholders today in Rustenburg about its turnaround strategies, intervention progress and financial performance since it was stripped of its powers. The administrator has been assigned by the national government to assist the ailing department. Itumeleng Kgajane spoke to the MEC in the province.
Welcome to the Northwest Province. Indeed, we have been covering a press conference addressed by the MEC of Health here in the Northwest, Dr. Magome Masike. They were talking basically about the turnaround strategy that the department will embark on because, as you would understand, this department has been put under administration and the powers have been taken now by the national government. Now, to look into this and to get a clear understanding of the department's program, we are joined here by the MEC of Health, Dr. Magome Masike. Dr. Masike, thank you very much for making time to speak to us. You have been addressing the media and you spoke at length about the turnaround strategy that you as the department will be embarking on. Please kindly take us through those turnaround strategies.
Well, today we are in a provincial consultative forum to share what we've been doing and the strategy itself so that we get inputs from communities. Today we've got chairpersons of boards. Today we've got chairpersons of the District Health Council. We've got clinic committee members. We've got CEOs of hospitals. And we've got CEOs and chief directors to come and share ideas. We're here the whole day. What has been found is that much as when we talk about the core business of the organization, that we prevent, diagnose, treat and control disease, we're doing critically very well. The problem is financial management. And like I've already pointed out that we have a CFO, a chief financial officer at a DDG level. We have no chief directors, no directors. We've got deputy directors. So we need people to run the financial management system. Systems are run by people. And from this weekend, we are beginning to prioritize the posts. We've got money to get 223 people on board, and we are advertising since from this weekend. So we came to inform our stakeholders, and they must make inputs into that. They must also make inputs into how we are going to improve the quality of healthcare in the province. They give us feedback because they are recipients of this healthcare system. So they will be better placed to come and tell us how they feel about it. Remember here we had the Khosi. We had all the people that I've mentioned, the councillors are here.
Okay, now we understand also that the national government has put your department under administration through invocation of Section 101B, which means now the powers are with the national government. Please talk us through that and maybe introduce to our viewers the administrator who's been tasked with the responsibility of working with you in as far as improving the situation at your department.
Ms. Jeanette Hunter and her team, I've already met them. Highly qualified people who are coming to make sure that we put into place everything that needs to happen, especially the intervention plan. The first one that we've done is to have direct deliveries of pharmaceuticals from manufacturers to our major hospitals. The drug level in our hospitals has already improved just because of that strategy, that not everything must go to the medical depot in Mafike, and then from there to the hospitals. Some of the major hospitals, like we've got in Vryburg, in Rustenburg, in Klerksdorp, and Potchefstroom, get their drugs directly from manufacturers. Good strategy, it's working. I can tell you now that the drug level in those hospitals is in the 90s, 94%, 98%, which is very good. They're going to put into place a better supply chain management system in place, and they're going to make sure that using their weight from national to speak to provincial and national treasury to give us more money to employ more people.
And briefly, MEC, before the department was put under administration, how took to the streets to highlight their plight, to say they do not, they have a problem with the 30 million rand prepayment made to Mediosa. They had a problem with the HOD who apparently made that payment. Tabole Kalakala. How's the situation now? What's the situation with Mediosa? What's the situation with Mr. Lekalakala, who was suspended, came back to work, had his suspension extended? What's the situation there?
The situation is that the allegations have already been written now. They are going to be served to Dr. Lekalakala, and the disciplinary process will then proceed. Well, the Midiosa contract has been cancelled, so we don't have Midiosa anymore. The NEHAU and its members, we're talking to them so that we pay them their bonuses. That they were very unhappy that a company called Midiosa could be paid 30 billion before even starting work, and yet their bonuses were not paid. We've been able to talk to them. They understand the situation better today, and we believe that going forward, there must be a good relationship between government and labor.
And briefly once more, MEC, what would your role be now? Because there's the administrator now working with you.
You know, we work as a team. You may have individuals, but we work as a team. Remember, it is the Public Finance Management Act that is a problem, and I don't participate there. You know, so the politics of the Northwest are not under administration. It is the Public Finance Management Act that is a problem. Supply chain management is not in the ambit of the MEC, so I don't participate in procurement, for instance. So this is the things that they're coming to help us with, where we had a skills gap within the organization to do it, and we welcome them.
Thank you very much, MEC, for making time to speak to us. That is the MEC for Health in the Northwest Province, Dr. Magome Masike, talking to us about the strategies that they are putting in place to make it a point that they get things in order again in this Department of Health here in the province. Because you'd remember, before the department was put under administration, there's a point where the NEHAU took to the streets, complaining about the performance management bonuses and many other things. So the MEC says those things are being addressed, and how is also being worked with to ensure that the department gets back to gets running once more. So from us here in the Northwest Province, is back to you in the studio.